Is radiation from lymphoma imaging scans dangerous? Imagine going for a scan that helps your doctor see inside your body to find out if lymphoma is present or how it's responding to treatment. These scans, like positron emission tomography and computed tomography scans, are powerful tools that provide detailed pictures of your tissues and organs. But some people wonder if the radiation used in these scans could be harmful. The truth is, radiation exposure from these imaging tests does carry some risk, but it is generally very low and carefully balanced against their important benefits. These scans use a form of energy called ionizing radiation to create images. This type of radiation can damage DNA, which is the genetic material inside our cells. Damage to DNA can, in rare cases, increase the chance of developing secondary cancers later in life. However, it's important to understand that the amount of radiation from these scans is carefully measured and kept as low as possible. For example, a single computed tomography scan of the chest delivers about 70 times the radiation of a standard chest X-ray. While that might sound high, it is still within a range that is considered safe when used appropriately. The risk from radiation is also related to how often these scans are performed. Repeated scans over time can add up, increasing the cumulative dose of radiation a person receives. Younger patients and women are generally at a slightly higher risk because they have a longer remaining lifespan during which radiation-induced effects could develop, and some tissues like breast tissue are more sensitive to radiation damage. Research shows that the overall increase in cancer risk from medical imaging is small but real. Large studies suggest that a tiny percentage of future cancers could be linked to the radiation from scans. Still, these estimates are based on models and should be interpreted with caution. The key point is that the benefits of these scans in diagnosing and monitoring lymphoma usually outweigh the small potential risks. They help doctors determine the stage of the disease, guide treatment decisions, and check how well treatment is working, which can be life-saving. Medical guidelines emphasize the importance of using imaging wisely. Doctors aim to minimize unnecessary scans, especially in patients who are in remission or have a low risk of disease progression. This approach helps reduce radiation exposure and also eases patient anxiety about frequent testing. It's worth noting that magnetic resonance imaging scans do not use ionizing radiation at all and are considered safer in that regard. However, they are less commonly used for lymphoma because they provide different types of information compared to PET or CORT scans. In summary, while there is a small risk associated with radiation from lymphoma imaging scans, it is generally very low. The critical point is that these scans are vital tools that help ensure accurate diagnosis and effective treatment. Healthcare providers carefully weigh the benefits against the risks and follow guidelines to keep radiation exposure as low as reasonably achievable. If you have concerns about radiation, discuss them with your doctor. They can help you understand your specific situation and decide the best approach to your care. Remember, medical imaging is a powerful tool designed to help you get the best possible outcomes with safety in mind.